if we recorded the previous,
Yep, we can
we are now.
record now, and then you can share this with Representative Morgan or anyone else who wasn't able to be here. We'll save this to the cloud, and then that will give us a link that we can share after. If that's okay, Representative Edwards, that's your call. We can stop.
I think we should go ahead and record it because for Representative Nordgren, in case she's interested.
Okay.
And then I don't know if it needs to be available to the public or not, since it's an orientation. But
Okay.
Just FYI, Representative Edwards, Karen Rounds is
Yes.
available now.
oh, there you are. I see you. Hi. So,
Hey, I apologize.
as Chair of Division 3 of the House Finance Committee, I find that due to the state of emergency declared by the governor as a result of COVID-19 pandemic and in accordance with House Rule 67, the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. This is a public meeting pertaining to division orientation matters. Please note that there is no physical location for members of the public to observe and listen contemporaneously to this meeting. However, in accordance with the emergency order, I am confirming that all members of the committee and select legislative staff have the ability to communicate contemporaneously through this meeting, through the Zoom electronic meeting platform, and the public has access to contemporaneously listen and, if necessary, participate in the meeting by the Zoom platform or by telephone. All necessary access information has been made available in the House calendar and through the electronic calendar on the General Court website. The notice for this meeting complies with House rules and RSA 91A. Anyone who has a problem accessing the meeting should email LBA_fiscal, FISCAL, at leg.state.nh.us. In the event the public is unable to access the meeting will be adjourned and rescheduled. LBA staff are on the meeting assisting us. Please note that all votes that are taken during this meeting shall be done by roll call vote. There will be no voting today, though. Let's start the meeting by taking roll call attendance. When each member states their when each member identifies themselves, please state your presence. Also state whether there is anyone in the room with you during this meeting, and that's required by the right to know law. So, Mr. Vice Chair, are you ready to take a roll?
I have the roll.
I don't actually have the list. I mean, I know who the people are, but
Whatever, you're the guy, whatever you want to do there.
I thought you wanted the clerk to call the
I think
roll.
that's the guy that should be doing it.
I'm sorry, that's a clerk roll. You're right. So,
All right.
Clerk, are you ready?
I am. Representative Edwards.
I'm here. I'm in my office in Auburn. Nobody's in the office with me. My family's in the house, though.
Representative Irv.
I am alone. I'm here and I'm alone in my home office.
Representative Weiler, I'm in Kingston. I'm alone in this room, but there are others in the house. Representative Bean.
I'm here. I'm in Guilford at my home. My wife's roaming around here somewhere.
Okay. Representative Wallner.
Representative Wallner's here. I'm in Concord in my home, and I'm alone.
We've decided Representative Nordgren is excused or likely to come late.
I just got a text from her, and she's on her way, but she will be a little bit late.
Okay. Representative Rogers.
I'm here in Concord in my home with my dog.
Chairman, we're all here, except for
All right.
Representative
Thank you,
Nordgren
Mr.
will come late.
Thank you. So I did send an agenda for today. The next item up after the attendance are member introductions, just to get to know each other. It's a little awkward because you guys know each other, and I don't really know you all very well. Some of you have written to me, which was very helpful. But so I'm Jess Edwards. I'm a retired Army officer. I had a hybrid career stretching for 1/3 of a century to the day, 33 years and 4 months. I was a medical services corps officer, which is basically a hospital administrator. I specialized in operating units out in the field. I was a comptroller. I was a healthcare informaticist, and I did large-scale medical operations planning as well. I got out of active duty, though, other than some deployments to Afghanistan in '91, and I started a parallel career working for medical device manufacturers, where I was a project management officer and product manager. So I've been around the healthcare field. You know, my dad was in it, and so my whole family has kind of been healthcare oriented. I had a finance degree in college, a couple of master's degrees, one in computer science and one in systems management. And that's what really prepared me for kind of the healthcare informaticist role. So I'm really excited by this opportunity. Looks like Representative Nordgren has joined us. And I'm a big Nebraska college football fan. I grew up starting at 10, going to school, going to games with my dad. And I'm married. This is the year of our 40th anniversaries. Got 2 kids, 2 daughters. Elizabeth, some of you may know, she was a state rep for 2 terms. She's the one that got me interested, so I could, the family joke is I needed to run to counteract all her votes. So that's just a family joke though. So, but in any case, I really enjoy the State House. It's my 3rd term. I was in Health and Human Services the 1st term, and then Ways and Means. And so I feel like I've got a good background for this, but I need you all to be patient and train me a little bit. And that's it for me. Representative Irf, you want to go?
Hi, I'm Keith Irv. It's good to see you all again. Hi, Karen. Been a long time. I've served in Division 3 last term. Not much last spring, but very much the year before. You all know me, so I won't go into quite so much detail. I basically have my own software business, and I'm married with 4 children.
Representative Weiler?
Yes, graduated from MIT in '63, got married, went to pilot training, 6 years of active duty. When I got through with my Vietnam tour, I went into American Airlines and the reserves and stayed with American for 30 years and had a total of 30 years with the Air Force, retiring as a colonel. Been in the legislature since 1990. First came on, at the time, I think it was Appropriations Committee in '94. Had a couple of years I wasn't on Finance Committee, but I have about 24 years on Finance Committee, mostly on Division 2. I think I had 1 term on Division 3, or Division 1 rather. First time on Division 3. I'm going to learn something. Thank you. I'm married with, been living in Kingston for 50 years. My family grew up here, and some of my grandchildren grew up here. So.
You still fly? Can you hear me? Do you still fly?
Nope. I had a landing when a Cessna 185 2 years ago. And the guy that was with me said, "When's the last time you landed?" I said, 17 years ago. So a little rusty.
I was going to recruit you for the legislative squadron of the Civil Air Patrol, but okay. Hey, thank you for also volunteering to be our clerk. I was really kind of nervous about that.
I've had a lot of experience with that, even on this division. Not division, but Division 2.
So how about you, Representative Bean? What do you want to share with us, sir?
Can you hear me?
I can hear you.
Well, I got married when I was 16. I'll be married 50 years this year. I got 2 children. I spent 3 years on the Budget Committee in Guilford, and obviously 2 years on the Budget Committee for Belknap County. I'm a contractor, construction worker, and I own some apartments in the city of Laconia, and I'm a professional arm wrestler.
Something happened to your audio.
Mine?
There you go.
Are you still there?
So, yeah, it sounded like you went into a tin can for a moment.
Oh, I think there was other noise on the tablet. I don't know where I left off.
Professional arm wrestler.
Professional
Oh,
arm wrestler. So if we have a cross committee championship out, we'll nominate you for that.
98, I took second in the world right-handed and third left.
Oh, wow. All right, Representative Wallner, can you beat that?
No, I'm not an arm wrestler, that's for sure. I'm Mary Jane Wallner, and I'm been in the legislature for, I guess this is my 21st term. So I'll be going on 42 years in the legislature. And I've served on the Health and Human Service Committee, the Child and Family Law Committee, and most of my time I've been on the Finance Committee for 24 years. For a couple of terms, I was the majority leader. I was also the deputy minority leader one term. I spent most of my time on Division 3, and I am retired at this point. I was the director of a child care agency for almost 45 years. I have two children. One lives in Texas and one lives in Massachusetts.
Oh, okay. Well, if you see me doing something wrong, please train me. Representative Nordgren.
Hi, sorry I was a little late. I've been in the legislature since '88, and I was on the Board of Selectmen in Hanover and chair for the years before I became a legislator. I was on, I think, Children, Youth, and Elderly is what it was called, Mary Jane, when I was on it with you. And then she went to Appropriations Committee, probably Ken was there. And then I joined her and Ken in '92. And I've always been on Division 3. I think that's what it's called. And I have 5 doctors in my family, so I sort of know a little bit about the healthcare system. And I have a son in California and a daughter in Portland, Maine. That's it.
Hey, Representative Rogers, what would you like to share?
Well, I'm serving my 8th term in the legislature. And I've served on Public Works Committee when I was first here, served on criminal justice, served on the long range capital planning, and on finance for the last 4 terms. I've been on Division 1 and on Division 3. Interesting tidbit about finance. When I was in, I think it was 2nd and 3rd grade, I used to attend appropriation meetings with my mother. My mother was the administrative assistant to what was then called the warden of the state prison, but he actually ran the corrections department, and he used to come and present the budget. Actually, my mother presented the budget. She answered all the questions. And I remember at night when we'd go home, she spoke about the Appropriations Committee a little differently than she did when she appeared before them during the day. So I had that perspective when I was growing up about how some of the members of the Appropriations Committee dealt with the employees. So that, I guess, gave me a good training of how to deal with people that came and appeared before the committee, because I remembered how some of them dealt with my mom. And that was good training, I think. I have lived in Concord my entire life and went to schools here. I have served as a prosecutor most of my adult life. Was the first female prosecutor, county attorney for Merrimack County, and have served as a police prosecutor. So my background is in criminal justice. I have probably my greatest interest in Divisional 3 is the children and youth part of it, especially I have a great deal of interest in YDC and with what happens with Sununu and the amount of money we're spending there and what we're getting out of it. And I think we'll all find a lot of interest there. I know Representative Weiler knows the complete sinkhole, I guess, is one word of using of what we've dealt with there. I also share with you, Representative Edwards, a great love of dogs. And while I'm not a college football fan, I grew up with my dad taking me to the New England Patriots, or what was then the Boston Patriots games, from when I was a child. We would go to the games every year, and I recently found our first tickets to the games. He was a season ticket holder the first year, and the tickets were $5 a seat. Now I still have inherited his season tickets, and let's just say they're a little more than $5 a seat, unfortunately. But I'm a huge football fan, so we can share that as well. When we tend to disagree on a lot of other things, at least we have dogs and football.
Well, I've been learning how to become a Patriots fan. I found like that it was essential to my new career.
They're a good team.
Yeah. So Mr. Kane, do you want to tell us a little bit about yourself, or do you think everyone knows you?
No, I can tell that I'll start my video. So hi, my name is Mike Kane, and I'm the legislative budget assistant for the state of New Hampshire. Just a brief background: I grew up in Quincy, Massachusetts, and went to college at Merrimack College. Moved up to New Hampshire in the 90s. In my previous career, I worked with the House Ways and Means Committee down in Massachusetts as a budget analyst, working on some transportation issues, including big dig financing, as well as funding of the MBTA, which is their train system down in Massachusetts, and then moved up here with my wife, Jennifer, and I have 3 kids. I've been in the LBA for 21 years, recently appointed the LBA in 2015. So I won't bore you with any more than that.
That's all pretty great. Good. So Mr. Ripple, sir.
Sure, yes. Kevin Ripple, I think I know pretty much everybody here, except I haven't met Representative Bean yet. But I look forward to working with you all. I've been with the LBA since 2007 in one capacity or another. Prior to that, I got a master's degree in public administration. And in 2007, upon graduating, I went to work for the audit division. I stayed there for about 5.5 years before volunteering with the budget division for the 2013 budget session. And then I started full-time with the budget division that summer. I started out with Division 1, was there for a couple of years, and I've been here with Division 3 since 2016, I believe.
So did Karen Rounds, this is a little unexpected, but
Yes,
you
sir.
probably know yourself well enough to tap dance through an intro. So.
Sure. I'd be happy to share a little bit. First of all, it's great to see you all, and welcome to the community, Representative Edwards. It doesn't feel like it's been 2 years since we were all together, but I guess it really has been. I'm Karen Rounds. I am the Chief Financial Officer for the Department of Health and Human Services. As Kevin will tell you more about, I'm sure later, we have about a $2.6 billion budget a year, a large majority of which are federal funds, many of which cannot be earned without the matching general funds. I am a CPA. I have an accounting degree. I have worked for HHS for 3 years. Almost 3 years. Before that, I worked for the Department of Revenue as their assistant audit director, and as an auditor prior to that, which is why, as many of you know, I sometimes have strong feelings about revenues and tax policy, which I'm now allowed to have a personal opinion on now that I no longer work for the department. But I have great friends over there, and they do a wonderful job. What else did I want to share? I currently live in Bristol. I just put my house on the market though, and have 30 showings between today and tomorrow, which is insane. If anyone's looking to sell their house, apparently it's a great time. Just moving a little closer to Concord, so we'll still be in the area. I do not have any kids. I'm married 14 years. Similar to Representative Rogers, my mom was a town administrator for a small town in New Hampshire. And my brother is a fish and game officer, so we're both very dedicated to government service. And I don't have children, but I have 2 amazing nephews, 7 and 3. The 7-year-old who is already well on his way to being way smarter than I am. So, so pretty proud of those two.
Thank you. Hey, so, Mr. Ripple, do you think Ms. Clayman is on the phone with the LBA staff? I just see a picture. Is it? I don't know humans there.
Let's see.
There's Janet. She just popped.
He is, and I have Janet, if you're listening. I just allowed you to talk. I think I saw you show up. So if you unmute your phone, Janet, or computer, you'll be able to introduce yourself.
I'll unmute. Hello, everyone.
Hello, we can hear you.
Okay, good. Well, nice to see you all.
You want to say anything about yourself, your background, anything?
Do I? Oh, okay. Well, I'm Janet Clayman. I'm the Legislative Assistant for House Finance Committee. I've been doing this job since, I believe it was 2005. I had previously worked for the House back in 1986 to 1990, and then I left to have a bunch of kids. And then I came back, like I said, in 2005. I have 4 children. They're all grown up. One lives in Germany, and one lives in Boston, and the other 2 live in Sununu. And I don't know what else what you want to know about me. I've worked with Representative Erf and Representative Wallner and Representative Rogers, pretty much, and Representative Weiler. And I can't see if there's anybody else on here. It looks like it's just you folks.
It's the whole Division 3, that's for
Oh.
sure. And then we've got Mr. Kane and Ripple, and Karen Rounds, obviously. She just,
Oh, yeah, I saw Karen. Yeah, yep. So
Well,
I'm
thank
here.
you.
I'm here to help.
And thank you. I'm looking forward to meeting you in the real world as soon as this pandemic goes away.
That would be very nice.
All right. Well, let's go on. Mr. Ripple, you've got an LBA briefing you want to share with us, sir?
Sure, yes. And I did email that out to all the members, but I'll also share my screen here so it's a little easier for you to see. So let me just turn off my camera.
Sharon.
And let's see, here we go. So you should be able to see my screen now. Does that look, can everybody see that?
Yes.
Okay. So we'll start from the beginning. There'll be a little bit of overlap with Mike Kane's presentation to the full committee the other day, but that's okay. If you take a look at this briefing on the second page here, you can see all of our contact information. Yeah, I have my email address and my office phone number if anybody needs to get in touch with me. Even though we're not physically present in the office at the moment, I am checking my voicemails, so you can always do that. I think I've also provided Representative Edwards with my cell phone number. I'm not sure if he shared that with the committee, but feel free to call me whenever you need to. As we scroll down, we just have a quick look at the operating budget process here. Obviously, we're in the governor's phase. The agency put out its budget request back in October. And from November until the next couple of weeks, the governor is going to be completing his proposed budget. And by law, the governor has to submit that to the legislature by February 15th, although I think we've heard that he may be presenting it a few days earlier this year, possibly on the 11th. And usually, shortly after the governor's proposed budget comes out, a couple of weeks later, his proposed trailer bill will come out as well. And the committee will be holding a number of meetings on that as well. So the House phase really begins in earnest in mid-February after the governor has presented his proposed budget. And the committee will be meeting likely several times a week between mid-February and late March. Starting in mid-February, usually right away, we'll have the agency come in to talk about the various aspects of their budget. And we can work out a calendar for that a little later. At times, the full Finance Committee has heard presentations from each agency, or at least each of the major agencies, prior to the divisions beginning their work. I'm not sure if that's going to happen this year or not, but that's a possibility. And then finally, after the House finishes its work in late March, we move on to the Senate. That continues on from April through June. And at the end of June, mid to the end of June, there'll be a committee of conference phase, at which point we'll wrap everything up. So moving on here, we have a list of helpful websites. I won't visit all of these, but they're here for you to peruse. I will just bring you quickly to our own website. If you go to the LPA site and then under Budget Division, click on Budget and Revenue Documents, that'll bring you here. So we have documents for all of the operating and capital budgets going back to 2010. And if you look at the 2021 page, you can see the type of information that we tend to put up there. We put up all the major documents for everybody to see, members and the public alike, including obviously House Bills 1 and 2 as they move through the process, the capital budget, House Bill 25, detailed change reports, which are documents that we produce showing the changes from the House finance budget to the governor's budget, the Senate budget to the House budget, et cetera. So you can see what's happened in each stage of the process. We'll also post amendment packets here. When the full House Finance Committee hears from the divisions, they will see packets that contain proposed changes to House Bill 1 and House Bill 2. We'll post that here, as well as compare reports, surplus statements, et cetera. So all the major documents get posted here. Because this year will be a little bit different and we'll be doing more work online and in a hybrid fashion, excuse me. We will also be setting up pages specific to the divisions. They aren't online yet, but we will have a Division 3 page, and the idea is to post there literally everything that's distributed throughout the division's work. So everything that comes through the division will ultimately be made available online. So scrolling down here, the next couple of pages are basically different ways of looking at the budget. We have some tables, we have some pie charts, but you can see here that HHS, which makes up category 5, comprises almost half of the state general fund budget and a little under 43% of the total budget, including federal funds and other funds. Scrolling down again, more ways of looking at that same information. And once again, Division 3 comprises all of category 5. So I think at that point, I will take you down to the part of the briefing that's specific to Division 3. Which begins here on page 32. I'm sorry, 52. And here you can see broken out the major components of the HHS budget. You can see the biggest component by far is Medicaid. We're looking at all funds here, and the Office of Medicaid Services comprises about $1.2 billion in total funds out of a 2.6 to roughly $2.9 billion budget. So scrolling down, we get into some specific program areas. I'm not necessarily going to go through all of these in detail. I think they're here for you to read at your leisure. You don't necessarily have to hear me talk at you about them, but I am going to highlight some of the big areas within the HHS budget. And the first one I'd like to talk about, well, I guess we'll gloss over the Child Development Program and Child Protection and Family Services first. The Child Development Program, among other things, funds childcare scholarships for families and provides assistance with the cost of childcare so they can maintain employment, participate in training, et cetera. And you can see here that their operating budget in fiscal 20 was about $14.3 million in general funds and $16 million in general funds in fiscal 21. For each of these items, I've shown you the general fund component for the 2021 budget, as well as the general fund component of the agency's budget request for 22-23. Now, obviously, that's not going to be the same as the governor's budget, but for perspective, you can see what the agency has requested. Moving down to child protection and child and family services, that contains roughly 62 to 68 million in general funds per year in the current 2021 budget. That budget also added significant funding, as did the one before it, for a variety of positions, specifically child protective service workers, social workers, licensed alcohol and drug counselors who are contracted with the department, attorneys, nurses, social worker services, etc. That was in response to an independent review of DCYF, as well as a lot of items that were in the news a while ago about the caseload, specifically the high load per case worker within DCYF. So I believe that caseload has been brought down a little bit. The department will be able to speak about that in greater detail when they appear before the committee in a couple of weeks. So moving down, we have the Sununu Youth Services Center. This is always a hot topic for Division 3 and the Finance Division generally. That's because when the Sununu Center was constructed back in the early to mid 2000s, it was constructed using partially state funds, partially federal funds as a 144 bed facility. But over the past several years, specifically over the past 4 or 5 years, a couple of policy changes have resulted in the daily census at the Sununu Center dropping significantly. So rather than 144 beds being filled, I think as of the last dashboard that the department put out, I believe there were 14 juveniles currently occupying the Sununu Center. And over the last couple of months, it's actually been as low as 9 occupying the Sununu Center. So that's a very large facility for a very small population, which always causes some budget issues. There are 4 wings at the Sununu Center. I believe currently only 2 of them are being used. So it's a large facility. It has a large maintenance budget that's generally fixed. It has a staffing budget that to some extent is also fixed. For example, they need medical staff 24 hours a day, regardless of how many kids are there. So it'll probably be a hot topic going forward. There have been a number of commissions and a number of study committees that have looked at the issue of what to do with the Sununu Center and how to fund it going forward. The most recent of those took place in 2017, 2018. And I can find copies of all of those reports for you if you'd like to take a look at them. But they recommended converting the unused pods into either a privately run substance use disorder facility for juveniles or a facility for pregnant teen and teen parent programs. And you may know that one of the unused pods was previously used as a substance use disorder facility for juveniles, but that I believe is no longer the case. So you can see there that the general fund component of the Sununu Center's budget was 10.6 million in each year of the 2021 biennium. And that was deliberately designed to remain flat with the budget in the 18-19 biennium. The agency's request going forward is about 14 million per year in 22 and 23. And that does include some funding for additional prioritized needs.
So I raised my hand there. You probably can't.
Sorry, I didn't see that.
Doesn't jump out. Okay, so some of these physical locations, when we get the Rona behind us, I would like to actually go see them.
Yep.
Have they provided tours before?
They have. And during the last budget cycle, we actually went over, all of Division 3 went over and took a tour. So yeah, I think once COVID is behind us, they should be easily able to do that.
Okay. And in the Division of Human Services, is this where the domestic violence fund is?
Domestic violence, I believe, is in Human Services, yes.
Okay, because it's not mentioned here in your paragraph, so I just wanted to know where it was, so it's in here somewhere.
A couple people have raised their hand. I may not have hit on that in this briefing, actually. I didn't cover everything, but I can certainly provide information going forward. And actually, domestic violence might be in, now that I think about it, that might be in substance use disorder, so.
And then as you're just swinging by, if you could point out where New Futures and not Wayfair, what's the name of that? Waypoint? Where they fit in the budget too.
Okay, sure. That again would be in substance use disorder services when we get there.
All right.
Representative Nordgren has her hand up too.
Seeing how Jessa asked a question, I thought I could ask a question. So when you were talking about House Bill 1 and 2, you said House Bill 2 was a trailer bill. I think for the members that are new, you might define what that is.
Oh, okay, sure. Good point. The trailer bill is the bill that basically effectuates all of the changes in the budget that aren't numbers. So in other words, if tax rates change, those would have to be in the trailer bill because the state Supreme Court decided many years ago, back in the 80s, I believe, that the budget couldn't change state law or state statute. It could only appropriate funds. So all of the policy areas that pertain to the budget are contained in that trailer bill. And it's usually a very big document. It varies by year, but it's not uncommon for there to be several hundred sections in the trailer bill as it makes its way through the process. And the fact that it's so big is the reason it usually comes to us a little bit late. The governor usually gets that to us a couple of weeks after his proposed budget comes out. And as we go through this process, I'm sure you'll have many proposed amendments to the trailer bill, and that's something that the committee can take a look at going forward. Okay, so I think skipping down to the Division of Transitional Assistance and TANF, Temporary Assistance to Needy Families. This is cash assistance and emergency assistance to families with children in which one parent is absent for one reason or another. New Hampshire, as Karen alluded to when she spoke earlier, HHS receives a lot of federal money that requires state funds to be spent in order to receive it. And TANF is a good example of that. New Hampshire receives a $38 million federal block grant, but in order to receive that funding, it has to spend $32 million of state money as a so-called maintenance of effort. And any amount that we spend below our maintenance of effort requirement results in a corresponding reduction in the federal grant money. There is also a Tanf Reserve account, which isn't a formal account, but it's basically unspent federal TANF funds. And in the past, that reserve has been quite big. It's gotten up in the $50, $60 million territory. However, over the past few years, as eligibility requirements have changed and as benefit levels have changed, and as the state has relied on TANF funds for a wide variety of programs, that reserve amount has been drawn down quite a bit. So in the last budget, there was a lot of work done to try to make sure that the reserve didn't, quote, fall below zero, even though it's impossible for it to actually fall below zero. I think Representative Wallner has a question.
It's about the TANF Reserve Fund. I wondered if we knew what the balance of it is at this point.
And I don't know what it is right now. That's not information that we have access to at the LBA. We'll have to go through the department for that. But they will be able to provide that in the next couple of weeks. Usually they do provide a long document showing where all the TANF funds are spent and the projected balance at the end of the biennium. So we should get that going forward.
Great. Thank you, Kevin.
Sure. So moving on, we have SNAP, the Supplemental Nutrition Assistance Program. This was previously known as food stamps. Not a huge state commitment here. The benefits themselves are 100% federally funded, but the administrative cost is shared 50-50 between the state and the federal government. I'm going to skip over the state supplemental programs here: old age assistance, aid to the permanently and totally disabled, and aid to the needy blind. but we can come back if anybody wants to talk about those. And we'll move on to the Office of Medicaid Business and Policy. And as I mentioned, that's the big one. That's where most of the money is in HHS. So we'll start with the Uncompensated Care Fund, which is sometimes also known as DSH. That's the federal term, disproportional share payments to hospitals that serve a disproportionate share of indigent patients, basically. These are payments to hospitals to make up for uncompensated care from two sources. One is individuals without insurance coverage who haven't been able to pay their bill, or whose insurance coverage didn't pay the entire bill. And the other is the gap between what Medicaid pays for services and the actual cost of providing those services. So combined, those are the hospital's uncompensated care. And the state makes an effort, along with the federal government, to reimburse them for that uncompensated care. We fund that via a Medicaid enhancement tax on hospital net patient service revenue. Now, in the past, and I'm going back into some of the history here, the state collected MET, matched it with federal funds, and then sent back to the hospitals immediately the same amount that they had paid in. That resulted in a federal audit that resulted in the state paying back a significant sum of money in overpayments to hospitals. And following that audit, the state back in 2009, I think for the first time, revised the formula for DSH payments to hospitals. That revision, followed by subsequent revisions, ended up in a slew of lawsuits. And the result is the agreement that we have today that was put in place in 2018. And if you scroll down to the next page here, you can see the details of that agreement, which is good until 2024. So the hospital pays back out to, the state rather pays back out to the hospitals an amount equal to 86% of MET revenue in the form of uncompensated care payments, an amount equal to 5% of MET revenue in the form of provider rate increases, and up to $250,000 per year to each deemed disproportionate share hospital as defined in federal law. The difference between this and the previous situation is that hospitals don't necessarily get back exactly what they paid in. Some may get back more than they paid in MET revenue, some may get back less, but they're not held harmless as they were previously back in the 90s through the 2000s. So of that MET revenue that the state collects, a portion is paid out to the hospitals in uncompensated care, as I just mentioned. A portion is dedicated to the state's Medicaid managed care program. So that MET that's put towards the Medicaid managed care program effectively reduces general funds spent on Medicaid, because absent that MET revenue, the general fund would need to cover the state's entire share of Medicaid costs.
I have a question here.
Yes.
So who are the legislative subject matter experts in the history of the MET? I would imagine we may have people on the committee, Division III committee now, that were actually involved in negotiating these details. I'm just curious who they were. Was that you, Representative Weiler or Wallner?
I think probably Neil Kirk and maybe Mary Jane was involved.
Yes, I was on the committee that we met throughout the summer of, I can't remember what summer, but it seemed like a long summer, and negotiated this agreement.
I'd like to talk to you about that history at some point, but thank you.
Okay, so moving on to Medicaid care management. This is the single biggest component of the HHS budget. This is the traditional Medicaid program for individuals who are eligible as a result of their financial status and their falling into one eligible category or another. You can see that including the Children's Health Insurance Program, which is budgeted separately, but was previously part of the Medicaid managed care program. The current operating budget appropriated $743 million in 20 and $760 million in 21 for Medicaid managed care. And the agency budget request, including additional prioritized needs, goes up to $813 million in 22 and $802 million in 23. This, I believe, is the only program for which I've shown total funds rather than specifically general funds, for the reason that I just mentioned, because the MET revenue that goes towards Medicaid managed care can be thought of as general funds because it effectively reduces the general funds needed for the Medicaid program. So moving down, we have the Granted Advantage Healthcare Program. This is the expanded Medicaid program that went into effect as a result of the Federal Affordable Care Act. It's been restructured a couple times over the years, most recently in 2018. Currently, under federal law, the federal share of program costs is 90% and the state share of program costs is 10%. Under current federal law, that's how the funding mix will remain. So per that 2018 bill that restructured the expanded Medicaid program, the non-federal share of costs is to be funded from three sources: insurance premium tax revenue attributable to premiums written for services provided to the population, revenue transferred from the Alcohol Abuse Prevention and Treatment Fund, and revenue received from an assessment on insurers. One thing that I will point out about this is that this program is off budget. So you will not see the expanded Medicaid program in the budget that ultimately comes out. It does have an accounting unit associated with it, of course, and I can show you that at any time, but it's not actually a part of the operating budget. It's funded by a special non-budgeted trust fund established in statute. Total expenditures for the program have been roughly $400 million per year, and that was true in fiscal 20 as well, with expenditures of $418.3 million. Moving on to the Bureau of Elderly and Adult Services. Several years ago, again in the mid-2000s, there was an agreement struck between counties and the state, in which the state picks up the costs of services for youth and counties pick up most of the cost for long-term care services. So as you scroll through the budget and you take a look at nursing home services, for example, you'll see that those are overwhelmingly county funds matched with federal funds, and the state contributes relatively little overall. So in the 2021 budget, for example, nursing facility services costs were appropriated for a total of $270 million per year, and the state commitment was about $14 to $16 million per year, with the rest split between counties and the federal government. County payments, though, are capped in state statute, and the amount of that cap changes with each budget. So this is something that will be included in the trailer bill. So in the previous trailer bill, for example, the one currently in effect, the county cap was established at $123.4 million in fiscal 20 and $126.9 million in fiscal 21. Typically, that amount does go up a bit each year. And counties also receive an aggregate credit of $5 million per year, which is intended to prevent them from paying more than they would have paid under the previous cost sharing agreement. There are a couple ways that the state tries to leverage federal funds to help out the nursing facilities, both private nursing facilities and county-run nursing facilities. One of those is the Mqip program, the Medicaid Quality Incentive Program, which is funded by an assessment, sometimes colloquially known as the bed tax, on nursing facility bed days. Those funds are matched with federal dollars and paid back out to all nursing homes, both public and private. The ProShare program, on the other hand, is specific to county nursing homes, and that is an attempt to match federal dollars with state dollars to compensate county nursing homes for the difference between what Medicaid pays for their services and what Medicare would pay for the same services.
Hey, Mr. Ripple.
Yes.
Okay. I'm looking at Mqip. I'm a
Okay.
little slow on the uptake here, but it looks like there's a 5.5% effectively a tax on the nursing facilities. We collect it and then we turn around and give it back to them.
Yep.
So we must be taking it from different people than we give it to. So who are the donors and who are the recipients?
Well, that I don't know off the top of my head. I know we used to have, and I'm sure I can find a breakdown of how Mqip is distributed between private nursing homes in the aggregate and county nursing homes in the aggregate. I'm not sure if we ever had a breakdown by each specific nursing home, but I'll see what we can find on that.
That's not a huge priority. It just seems like we're taking money and putting it in one pocket and paying it out in the next. And I'm just curious about that.
To some extent we are, but again, it's an effort to match federal dollars because everything that we bring in is matched with federal money and then distributed back out to the nursing homes.
Representative Irf had his hand up for a moment. Or did you intend to take it down?
It was the only to point out to you that the real thing that's going on there is the matching funds. So it's actually generating more money. It's not just taking out of one pocket, putting the others, taking out of the pocket, matching it, and then splitting it back up again to the same pockets with more money.
Yes. A similar thing as with MET in hospitals. Okay, so moving on to budget neutrality. The department's permitted under its Medicaid state plan to apply a budget neutrality factor to payments made to nursing facilities. And the reason for this is to ensure that payments don't exceed available appropriations. So if the state appropriates, say, a total of $270 million in funds per year for nursing services, but the actual cost of services is more than that, the rates need to be reduced accordingly. So if if the budget is 20% more, 20% less than the cost of services, the rates will be reduced by 20% in order to bring them in line with the budget. With the budget. We'll move down to the Division of Behavioral Health and the Bureau of Drug and Alcohol Services. The Bureau provides oversight of regional public health networks and contracts with a variety of providers to provide impaired driver rehabilitation service programs, among many other programs. It's also responsible for oversight of for-profit methadone clinics. And this, I believe you had a question about this earlier, Representative Edwards. This is where New Futures would come into the picture, some of the funding under this division. Scrolling down to the Governor's Commission on Alcohol and Drug Abuse Prevention. Under state law, 5% of gross liquor profits are collected and distributed to the Governor's Commission, which regularly meets and votes to approve contracts for a wide variety of providers. That percentage was in statute for many years, but as you can see from fiscal 2004 through fiscal 2015, the legislature suspended it every year over that entire period and ultimately appropriated an amount that was smaller than the 5%. From 2016 through 2018, though, the formula was changed from 1.7% to 3.4%. It bounced around a little bit, but the legislature made an effort to give to the Alcohol Commission the full amount of funding that was allowed by statute. And finally, in 2018, as part of the extension of the expanded Medicaid program, the full 5% was reinstated, and the Governor's Commission now gets that full 5%. It's also the case, though, that 5% has to be transferred to the Granted Advantage Healthcare Trust Fund, to pay for the cost of the expanded Medicaid program, with the department essentially backfilling that amount to fund the Governor's Commission. As of now, that backfill comes from donations from hospitals. We'll move on to community mental health services. The largest component of this, I think Representative Erf has a question here.
When you use the word donations there, is that in quotes?
It is a voluntary donation. There's an agreement with the state, I believe, but it's a voluntary donation. There's nothing in state statute that requires them to do it.
Okay, thank you.
So if we move on to community mental health services, one of the main accounts in there is the CMH program support account. And that funds 10 community mental health centers throughout the state. I believe there are now 10. And that received a general fund appropriation of $22 million in fiscal 20 and $25 million in 21. You can see the agency budget request goes up a bit in 22 and 23. Moving on to New Hampshire Hospital and Glencliff Home for the Elderly. There was a lot of activity surrounding New Hampshire Hospital in the 2020-21 budget. Specifically, the trailer bill appropriated $5 million for an inpatient psychiatric facility for children, as well as $8.75 million for the construction of a new 25-bed facility for adults on the New Hampshire Hospital grounds. I don't believe those projects have gone forward, but the department again will be in a better position to talk about those when they appear before the division. Moving on to developmental services. This is a significant part of the Medicaid program, and state statute requires the department to budget the full costs of services for persons with developmental disabilities and acquired brain disorders, and also requires the legislature to provide sufficient funding for those services. The operating budget contained $173 million in fiscal 20 and $183 million in fiscal 21, and you can see that the agency's general fund request goes up a bit to $192 million in 22 and $212 million in 23. And I believe the intent of those requests is to fully fund developmental services for the eligible populations. And finally, last but not least, moving on to the Veterans Home, which is not actually part of HHS, but it is part of Division 3's purview. The Veterans Home's budget request is relatively flat. They're asking for a little bit more. They had 18 million and 18.4 million in 21, and they're requesting 18.3 and 19.1 million in the upcoming budget.
So I have a question there, and it's actually a request of the Veterans Home when they come to present to us.
Okay.
Full disclaimer, I'm eligible to be put away in this Veterans Home someday, so. Having said that, I would just be curious what, given their average census, I would like to know how much they spend per patient, say per year, whatever the denominator is, per day, per year, per month, whatever, per patient, per period, compared to, say, a typical county home in New Hampshire.
Okay.
I'd like to just understand if we're doing what we should for veterans, if we're gold plating it relative to county care. I just would like to know relatively how we're doing. Is that something they typically provide anyways, that sort of comparison?
Not necessarily, but I can let them know what you're looking for, and they should be able to come in with that.
And I'll let them pick the benchmark they can compare to. It should be a reasonable benchmark is all I ask, so that we can do an apples to apples or close to it.
Okay.
Okay, do you have anything else to wrap up? This is a great presentation. I notice your style is a little different than Mr. Kane's. You actually breathe.
I'm glad he was here for that. You'll enjoy that one. Oh, I think you're muted, Representative.
Oh, I saw him on there. I wouldn't have said it
Yeah,
otherwise.
no.
I was breathing off camera. I'm breathing.
Okay, good.
Oh, you're muted again. Let's see.
Trying to mute in case the dogs go nuts.
Oh, I see.
So unless you have any summary wrap up on that, I think that was great. Do you want to take questions? Does anyone have any questions, given that we just went through a lot of data? I'm not seeing any. Okay, we can come back if there are some. So the next topic is discussion on process, committee deadlines, Zoom meeting best practices. I threw some bullets in here that I wanted to make sure we talked about. And that is that for as far as the eye can see, we're going to have either, well, from here on, it's going to be hybrid. I believe that there's been a commitment from the LBA to have us set up in the committee room for 1 week from today. But there is absolutely no pressure from me for anybody to show up in person. I want to be there in person, but there's no pressure from me on anyone. I'd kind of like to know in advance where you think you're going to be, just in case I want to chat with you. I'd like to know how to do that. Is there any commentary on hybrid meetings?
I got a note from somebody in leadership that they think that we could use the House chamber for a finance committee meeting briefing. And the plan might be for us to do that in the February presentation. So we can get whole committee in there. That's where they put 24 senators. And we could be in this, they have a desk and a little microphone at each of the places that is set up in the House chamber. And so we could meet there with separation and so on, and each be able to be on a mic when we had a question. And that might be what we do for the governor's budget presentation, because they've supposedly changed the whole HVAC system in the House chamber so that the proper ventilation and I guess ultraviolet lights have been installed in the vents and so on. So they think it's just about ready. So.
Well, that's good to hear. I think they put a lot of detail in the House calendar that I didn't intend to repeat for everyone, but I do think a lot of effort is going on to respect CDC recommendations on the precautions and to do this safely. So,
yeah. Lots of TV screens in that room now too.
Representative Wallner, do you have anything you want to add on the discussion of hybrid? You got your hand up.
Are you talking? I do have my hand up.
Yes, ma'am.
Representative Weiler, do you know, are we for sure going to have the briefing from the governor on his budget on the 11th? Is that?
We had an earlier discussion and nobody knows for sure whether we'll have it on the 11th or the 16th, the 15th possibly being a holiday. So, one would hope we would get it before the holiday rather than after, but those aren't for sure yet, unfortunately.
Okay. Could I have a follow-up to that? I also, will we also be seeing House Bill 2 at the same time?
I think we put that in law last time that it had to be the same.
We did.
I think you did in the last budget. So
yeah, I did.
Traditional.
We did. We did.
Yeah. And so.
Okay.
And hopefully it's delivered at the same point, because that's what I remembered we put in law.
Okay, great. Thank you.
It's unreasonable to wait and see it much later.
Representative Nordgren, I saw your hand go up, but I'm going to allow Mr. Kane to speak first in case he answers your question.
Sure. I just wanted to add that the governor may present his, typically what happens is the governor presents to the full House or does the state of the state on his budget. We've heard it could be the 11th, although that is in about 2 weeks. So it's pretty quick. I think how he does that is probably something that the governor's office is discussing with leadership right now, whether it be similar to his State of the Union address or his inauguration, where it is remote. But what Representative Weiler was mentioning is that the governor usually does, he or she comes into the House Finance Committee to present their budget, kind of a kickoff to the budget process, and will come in with the budget director. So there's a new budget director, Matt Mayo is his name. And I think on the 16th, and I think, again, leadership, Representative Weiler, Janet will work with the governor to see if he's available. Hopefully on the 16th would come and present either virtually or in person, probably virtually, to the full Finance Committee. And that would be in a hybrid capacity, as Representative Weiler had stated. The House chamber, actually, when they did upgrade the air conditioning, they did a full upgrade of the entire ventilation system. So that is in the whole complex. That's one room that is actually a safe room. And that's why the Senate's able to meet there. Again, smaller group, there's only 24 of them, but it does have the proper air exchange. Has been set up with hybrid capabilities so that members who do not attend are still able to participate, as well as the agencies, if they're presenting, are able. And so I think that's the game plan. I think there's still, obviously, it's a couple weeks. Anything can happen between now and then, but I know that leadership's working to come up with a plan for that.
Okay. So I don't know if it was technology or Representative Nordgren. Did you get your question answered? Do you still have something?
No, I think probably we'll know more later. I'm just obviously concerned about showing up and the mask rule and what that whole, in that room, what will be the situation with masks and keeping people safe. So I assume there'll be more information coming.
I would assume that too, and I just would want to reiterate that if you're not comfortable coming in, please don't, and we'll try to figure out how to accommodate you so that you feel like you're a full participant.
Thank you.
So the next up, public access before, during, and after. So I just want to remind you that once you get on Zoom, you might already be accessible to the public view. And so I just would caution you to make sure that your setting and your dress code and everything, what you're saying to your spouse, all of that stuff, you know, that may be live in public as soon as you turn on Zoom. So that's just a caution. I've asked Mr. Ripple to let me know if they go live, but I correct me if I'm wrong. Did I say let me tell you that we can go live like 5 minutes before, or did I say recording? I forget what I said.
You talked to me, I think briefly, Representative Edwards, about we'll wait for you to give the okay before the video's turned on, because if it is a case where members are getting ready, getting settled, there's no need to have that video on. But we'll wait for you. If for some reason you forget to notify us, we'll definitely start it by the time once you open the meeting. So we'll make sure there's no excess video.
I just don't want anybody accidentally embarrassing themselves with us being public when we shouldn't have to be. So also dress codes and nonpartisan backdrops. I would hope that we all think of our virtual environment as an extension of the decorum of the House, meaning that while we don't have a dress code, I think each individual attempts to dress professionally when they go to committee. And so because this is subject to public viewing, I would hope that you would use that same dress code. And then we're not supposed to have any partisan backdrops. So if you have any flags hanging in the back, please don't show it. I think the virtual background helps protect against that sort of thing. And an extension of that is I would like you all to be comfortable leaving your cameras active during the meeting. And we can talk about that, but I think as I read Article 38 of the New Hampshire Constitution, the last 10 to 15 words of it really, to me, say that we are meant to conduct our legislative business in public view with full transparency. So to me, that means we should have our cameras on and be live. Now, so Representative Bean, I don't want to put you on the spot. Do you have a technology issue there? Why we're just seeing your name? You're on mute right now, sir.
I don't know much about this tablet. It's relatively new. I'll have to talk to somebody that's more technological than I am and see if I can get this squared away between now and then.
Okay, I would not ask you to spend additional money on technology. I just say if you have the capability, it'd be great if you would leverage it for being in viewing. And then Representative Nordgren, I'd love to hear what you have to say. Go ahead.
For full disclosure, I'm actually in Dartmouth Hitchcock, dealing with heart issues. So I could turn it on and you could see my room, but hopefully I'll be back in operation next week.
Well, I hope you have a great visit and you have a full and speedy recovery. I would not ask anyone to have their privacy violated in any way. I'm just saying, you know, as a general rule, I think we should be transparent. That's an aspirational goal, but you should definitely do it in a way in which, it's a beautiful room, by the way, Representative Nordgren, and it looks like they ran your IV very well. So.
Right, and I'm watching the construction site. I'm supervising.
So, are there any other comments? I don't want anyone to feel abused and have their privacy taken from them, but are there any comments about this? Representative Weiler, you're the chair. Is this consistent with the guidance you're giving to other divisions?
Yes, it is. Thank you.
All right. So if you ever have an issue with that, just reach out and talk to me. I'm open. So as I understand, the feedback I'm getting from other people who've run Zoom meetings is that when people get on Zoom, they're kind of isolated in their own room and they don't have the same benefit of watching people's body languages. And so they tend to run on a lot longer. So if we are in a hybrid situation and you were speaking remotely, I would just ask you to keep it succinct. You know, just keep in mind that there is this behavioral issue where people speaking to Zoom, kind of like I'm doing now, just run on and on and on and on. And we just need to keep it synced, hit it and get it. And in line with that, I would say in the previous committees I've been on, the chair was in each committee was very rigid, or maybe the word's disciplined, very disciplined on allowing one question at a time from a representative. And after the question, the representative would go back to the chairman to say, I'd like a follow-up. Okay, because we're already handicapped, I think, by the technology, what I think I'd like to do is once you start asking questions, to kind of just give me an idea how many questions you've got and just keep rolling. I don't think it's good, given the limitations of the virtual environment, to have to keep going back and forth playing ping pong with each question. So Representative Wallner, you have your hand up. Do you want to speak?
Thank you. I think you just covered it actually. Since the Finance Committee is a little different because a lot of the questioning that we have is of department heads or agency people to answer our the questions about finances. Often you'll ask a question and often it brings you to another question because you need to sort of go down that track. And if you have to wait then to ask the follow-up question after everybody else has done it, it breaks the chain of thought, really. So I think if we can have follow-up questions and try to keep them short, that would be good.
Okay, good. So you're not disagreeing. We're all aligned there.
No.
then.
No,
I
that's what I think.
I think it goes without saying that I reserve the right to cut off questioning at some point, but I just would
Yeah.
like to know. I would just like to have some idea how, how long it needs to run for you to be comfortable. We're making big decisions, and I don't want anyone to feel like they don't have the information they need to make their own. Anything else on those two topics? Because my next up would be laptops and fluids. So my thought on this is certainly if you're in a virtual environment, you can have a beverage with you. I would even say if we're meeting with the department, I view those as probably more like working sessions than public hearings. I would tend to say, if you want to have a cup of coffee with you while we're hearing department briefs, that's okay. Would you agree or disagree, Mr. Chairman? Representative Weiler. I don't want to.
If you're in your own home, and I've seen it on most of the Zoom calls, people taking a sip of something. You're in your own home, you're fairly comfortable, so I don't think anybody can object to that. But when we're in the committee room, it's basically water. Because the cleaning staff doesn't want to clean up crumbs and spilled coffee and so on.
Right, coffee stains. Okay, so, and then we had a pretty hard no laptop rule in the previous committees, but the world has changed. And now I can see us needing a laptop so that we know what's going on with the virtual team members. So I would ask that you don't play games or goof around on your laptop, but if you need it up so that you can participate, more fully in the meeting, I'm pro laptop in committee hearings. Is there any disagreement with that? Okay. Not hearing none. That sort of wraps up the discussion on processes.
I think Representative Rogers has her hand up.
Oh, I didn't see it. Thank you.
No, I just want to thank you so much, because if I couldn't have my, as everybody on the committee that's been there knows, I live on the laptop and take lots of notes. So if I can't have my mini, I would probably have a nervous breakdown or somehow. Don't know what I do during the session, but I don't play games and I don't do whatever, but it's invaluable to me to be able to go back and check notes of what happened and so forth. So I really appreciate that you would let me continue that practice of having my laptop to take notes with. Thank you.
I am fine with that, and as long as we're not violating the finance chair's guidelines, I'm okay with it. I would just ask you to, for one boundary condition, a reason not to have laptops is because if you have the public there, the public wants to be able to, see you and interact with you and not think that you're, messing around. So as you're using your laptop, if you could just position it in a place where you still have visualization of the public, that would be great.
My mini is about an inch bigger than your cell phone. So.
Oh, okay. Well, that's not a problem. All right. So I had sent out a template on some things that I would like to have the departments come in ready to ask. I should try that, as long as we're doing this, I should try to do a share. Do you want to tell me how to share?
Go to your share screen at the bottom of the thing and hit that.
Should be a right underneath the pictures if you're looking at gallery view, kind of in the middle of the screen. Yep,
Here you
there
go.
you go.
So are you
There you go.
seeing something called Division 3 Chairman's Template, or are you seeing my?
There it is.
Yes.
Yes.
Oh, wow. God, this is so great. Okay, so I don't know if you've had a chance to look at it. I did float it by Representative Wallner and Irf and Mr. Ripple before, and maybe some others. So these are the kinds of things that I think I would like to know routinely when they're relevant to a particular department. And Representative Wallner asked me a good question, kind of the Goldilocks question of which departments are too big to be answering these kinds of questions and which of them are too small. And I don't really have a good guideline on that. Unless Mr. Ripple or Mr. Kane, you've come up with one. I would tend to just send it to the departments and say, answer to these, to the question that you perceive them to be relevant to the committee's decision-making, and don't go reinvent the wheel or try too hard to come up with answers. I'd leave it to common sense unless you've got a protocol you'd like to recommend.
I think that makes sense. I was unable to come up with a hard and fast rule. I think I mentioned when we talked about this that the department puts out a briefing book with all accounting units greater than $1 million. Now, that would be much too low. That would be much too low a level, I think, to provide all of this information, but they do provide some of it in there. So some of that information is already available, and perhaps they could fill in the gaps at a higher level.
So I don't know how many of you, I don't want to go line by line on this, but I do want to make sure that if you think there's a question on here that doesn't make sense to you, that I edit it before we send it to the department. Or if I'm missing something that you would like to normally know, we can add that. And I'd like to release this to Mr. Ripple tomorrow so that the departments have a heads up that we're asking this. And I think I saw Representative Rogers' hand go up and then Representative Nordgren. What do you have, Representative Rogers?
Yeah, my only request would be that we understand that not every question on this, I think, can be answered by the department, and that this is much more of a business model. And when we're dealing with health and human service agencies, there's not always a business answer in that. While I know that that people would like to say that they're customers and that they have a black and white answer, there's a lot more gray areas that we deal with here than quite often than other parts of state government. When we, for instance, deal with the disability community, there's an awful lot of gray area. The way the pandemic, for instance, has affected them, with a lot of them lost their caregivers because of the pandemic, because of the way that it affected them. It's very hard for agencies to then come back and predict how this is going to affect in the future 2 years. If it changes, we don't know when it changes or if it, however. I think there's a lot more gray area than can be specifically answered here. So I guess I would ask that we not be kind of 100% say you have to answer this specifically, because I think that there's just too much that specifically can't be answered. I think they can attempt to, but I just look at all of the different areas and my experience, and I know that Sharon and Mary Jane have even more, but when you deal with childcare, the disability community, the elderly community, that just the way the pandemic has affected them over the last year and the way it will continue to, and how they project out and how they even look at what's happened, it's going to be very difficult to answer some of these with black and white answers. Black and white is just impossible, I think.
I can appreciate that. I think if, well, one, I don't want them to over-engineer the effort to answer the questions.
Okay.
This is the kind of things that I tend to think about. And I think if they come across a question that this just doesn't fit, if they were to say that and say why it doesn't fit, I think that would facilitate learning on my part, if not others. So
I think maybe if we can just put a kind of provision at the beginning of it, that we do understand that that's a possibility.
yes, ma'am, I will work to make this purpose statement a little bit responsive to what you just said.
Thank you.
You bet. So in order, I think I had Representative Nordgren up next, and then Representative Weiler and Wallner in that order.
Yeah, I think I was just gonna make a nuts and bolt comment. So whenever the governor presents the budget officially to the House and Senate, then immediately we get this giant book that's about 6 inches tall. And those of us who've been around a long time, we take out section 5 of that huge book and we put it in its own little binder. So I guess the question will be that Mr. Ripple and Mr. Kane can put on their list of those people who then are going to do virtual. We will need to have that section of the budget sent to us.
I'll let Mr. Ripple answer that since that sounded like a question of him.
And I can answer it just so we don't put Kevin on the spot. Yeah, so that's what we're dealing with right now is the logistics of making sure that members who are in person as well as members who are remote have the same materials. And so we will do that. Representative, our plan, and we were talking about this the last couple of days within the office, our plan is to make sure that everyone gets a hard copy of the governor's budget. If you want us to separate that out, we can do that and separate just category 5 for the division members. Maybe we'll talk about that because maybe we can break it down into the 3 divisions, like 3 sections. So instead of getting one big governor's budget, you would get 3 each division. You'd get the whole thing. Everyone would get the whole thing, but you'd have them broken down so that you could always grab your section only as you're writing notes and going through that. And so, yeah, we'll talk with the staff and the best way how to do that, just to make sure you each get everything and your own. Okay.
Okay, I'm sure you're on the case. I just wanted to bring it up to the new members.
Yep.
Well, thank you. And if you can basically hardwire it so that we get it the way you think it should be, that would be really kind of nice, I think.
Yep.
So Representative Weiler, I believe you were next, sir.
Thank you, Mr. Chairman. One of the things that is our duty in going over the budget year by year is to look at areas of efficiency, and every once in a while we're in a situation where we have to make some pretty drastic changes. So one of the things I would add in writing to these different groups that come into us would be, what do you consider the most vital part of your agency and which part is the least vital? And you probably get 90% of them, 80% will say, oh, it's all vital. But every once in a while, you'll get a disclosure where somebody says, well, this such and such part was imposed on me. I'm not comfortable with it, blah, blah, blah. Or it's not as important as it was when I first took over, but it's becoming less important. And it kind of gives a clue as to where we might be making the most changes to save the most money. There might be some part of it that has almost become, no longer relevant, but they just keep people there because they don't want to lay anybody off. I mean, that's kind of extreme, but there are instances where we've seen things like that, or maybe that division should be somewhere else, or that piece of the operation should be somewhere else. But we're going to get some serious questions now about Sununu Youth Center. And if we did make further reductions, what would we do with this expensive building that was not put up that long ago to fully utilize it? Those are the things that we've got to look at. And there's a big piece of property there that I'm sure developers and the city of Manchester would like to get their hands on. So those are things we've got to be thinking of when we go through all this. And we'd be the ones that would have to make those changes, because quite often they have to be made in law. So those are just things that you might get some, if you ask the agencies, what's your most vital function and what's your least? So I'm hoping we get some honest answers that might give us a hint. Thank you.
So as I was thinking about that, I could just imagine from my days being a government employee, how you would not want to put in writing the least vital part of your department, because you would know that it's going to get stomped on and get your chain of command upset at you at the same time. So I wonder if there's, if we should talk about that some more, if you don't mind, sir.
Okay.
All right,
Well, you get an honest answer.
Yeah, once. All right, Representative Waller.
Thank you. I'm sort of going back to the template, but I want to just mention again, and I think it's already been mentioned, that one of the most useful documents we're going to have is the briefing book from Health and Human Services. I don't know if all the new members have actually had a look at previous briefing books, but it's very, very complete. I would say most of the questions that are on this template are answered. That you do have some that might not have been on it, but I think you'll find it to be probably one of the best documents we have as we go through the budget. It really lays out the case for what the department's doing and all the financial information. It's quite a good document.
Okay. Well, I'll take a look at that. I've not seen one. I've not looked at one yet, but thank you for the advice. And I don't want redundancy. I'm not asking them to do something twice. I just want to make sure that this is within the information we're provided. Representative Earth.
This is a question or comment back for LBA again regarding documents. If when you do the splitting up of the physical document, the budget, if you could also do it electronically and posting those as well. Same thing with the briefing book, and also the same thing with any documents that or presentations that the department is going to bring forward. If they could have those posted or available the day before, so we could download them and have them ready to go while they're going through them.
That's our plan going forward. Would love for all the agencies to provide any documents ahead of time instead of the day of. Kevin had briefly mentioned it. This year, we're going to have division-specific sites on our website so that every document you have will be presented. And what we can do is, yes, as you said, we could have category 5, for instance, specifically a link to that on the websites too. But I'll work with Kevin. I'll work on breaking that PDF down when we do receive it from the governor in a division friendly manner. And then we'll make sure that we post everything.
And hopefully keep it searchable.
Yes, and keep it searchable. That's the key. And I have talked to on the fiscal this past time was not searchable, but we'll make sure that all the documents are searchable. Okay.
Thank you. So our next meeting is scheduled for 1 week from today at 1 p.m. We've had New Futures and Waypoint ask us if they could come in and talk to us. The guidelines I gave them was no more than 10 minutes. I gave them some guidelines on the kinds of things that they should put in their document. I asked them to send the documents on a read-ahead basis so we can distribute it and you can look at it. I thought it would be okay to schedule this because we still have a little dead time between now and when we really get to work on the governor's budget. And this might be a way to learn more about the department. If you don't think this adds value to you as a committee member, it's okay for you to not come, but we'll do a public meeting and it'll be open to the public. I don't really like to talk to lobbyists one-on-one, just as a general rule. I like those conversations to be as public and transparent as possible. And so this is a way to do it. The other thing that Representative Weiler and I have talked about is to have the AG's office, the DOJ, come over and talk to us about lawsuits. My original idea was I wanted to kind of know about pending lawsuits so we could have some idea of what kind of contingency risk reserves we might need to be thinking about. But I've been convinced that that's probably not going to be available to us because of the need for confidentiality and not sharing information that shouldn't be in the public domain. So So Representative Weiler has suggested instead that we kind of take a historical view of the kind of lawsuits that are hitting DHHS. You know, Representative Weiler, do you want to talk a little bit about your idea on this? I think Mr. Ripple's been in contact with the DOJ, but everyone should kind of hear what you're thinking.
Well, as you and I discussed,
Hello?
the accountability for HHS isn't very high. You could have the same person getting in trouble all the time and being sued a lot of the time, but once the lawsuit is filed, it goes over to the Attorney General. And if there's a settlement, the Attorney General comes to fiscal and says, I need some money. And we put a certain amount of money in their budget anyway for settlements, but we never put in as much as we think we'll need because it becomes a target for lawyers. So what we do is we put in an amount and they come back to fiscal, but the HHS gets to wash their hands of what could be a problem. And it could be a certain person that's a problem. And so the accountability leaves the agency. It goes over to the AG. And, you know, I'm not comfortable with the AG not even involving us. I mean, I've done things in the budget. There was a lawsuit that occurred, and I waited for the AG to interview me to know how best to reply. Never got an interview. I called them up and said, what statement do you want from me? Oh, we're okay. So, you know, it seems to me we're not being properly represented by the Department of Justice. If we're being sued over our actions, we should be involved. And they're just totally ignoring us. And I don't find that very good practice of law. So that's a point I'm going to make with them. And if we had some accountability within HHS so that if they had the same person getting sued multiple times for the same sort of behavior, what are they doing about it? You know, they're just ignoring it and brushing it off to the AG. So I think that's a conversation we have to have. Thank you.
Thank you, sir. Any comments on that? I mean,
Not very loud, Jess.
Are there any comments on that? I think from the folks that have been experienced in this field for quite a while, what do you think? All right, I'm not seeing any hands up. No pressure. So, all right. So at this point, it's I just want to reiterate that next meeting is an invitation only meeting for the Division 3. If you want to dial in a little late because you don't need to hear what New Futures or Waypoint may say to us, but you are interested in the DOJ, then dial in a little bit late. That's all fine with me. And then we'll just if we're going to take attendance, we'll take attendance we'll make sure the attendance is correct at the end of the meeting. All right, last call for comments. Anything for the good of the committee. Normally, if we were in person, I would go around the table and just, you know, have you say yes or no. But in this format, if you have a last comment or something for the good of the committee, just raise your hand and you can speak. All right. Not seeing any. Do we need motions to adjourn, or do I just say, hey, I think we're done?
That's a good question, Representative. I did reach out to Jim Ciancio, who's the House Legal Counsel, to verify that, and it's okay for the chair to adjourn the meeting without having a roll call.
Good. All right. Well, then, not seeing any hands and knowing that everyone's been invited to say something before we close, I think we're done. So this was almost 2 hours. It was a little long. The next meeting, I think, is going to be well under 90 minutes. And so I do appreciate your participation. And reach out to me if you have comments that you want to talk about offline. All right. Thank you.
Thank you.
Thank you.